Hi, it's Ryan Jadinski again. Now we're going to do the abdominal assessment for the RN to BSN abdominal practicum assessment for RN health assessment. So now we're going to have the patient lay on her back, and we're going to make sure that we're on the right side of the patient. And for the abdomen, you always inspect, auscultate, percuss, and then palpate. You want to always inspect the abdomen looking down first, and then you want to take a look at it at eye level. And this appears to be a pretty flat abdomen. Next, you want to use light across the body to look for any abnormalities, and it appears that this abdomen is flat. Now we're going to have the patient take a deep breath, and no changes, and it still seems like her abdomen is within normal limits for her. The right lower quadrant contains the ascending colon, right upper quadrant contains the liver and gallbladder, along with some transverse colon. Left upper quadrant contains the stomach, spleen, and some transverse colon. And the left lower quadrant, for the purpose of this video, contains the descending colon. Now we are going to listen for the patient's bowel sounds. You always want to listen to bowel sounds for up to 5 minutes. If you don't hear anything, you start in the right lower quadrant, and those bowel sounds are normal. Right upper quadrant are normal. Left upper quadrant appear normal, and the left lower quadrant are normal. Again, if you don't hear anything, you want to listen to for up to 5 minutes before ruling that the bowel sounds are absent. Next, we are going to auscultate the cardiac vessels for bruits. We are going to listen midline, approximately where the aorta bruit could be heard. And I don't hear anything. Then we are going to listen to the left renal artery. Don't hear anything. The right renal artery, don't hear anything. Same thing with the femoral arteries. No bruits, everything seems to be within normal limits. Now we are going to percuss the right, being in the right lower quadrant of the abdomen, and tympany should be prevalent here. Then we're going to move to the right upper quadrant. And everything seems to be within normal limits. Tympany is prevalent. Now we are going to palpate all quadrants lightly, about 1 centimeter deep, in circular motions. And no abnormalities or masses or lumps felt. Now we are going to check the liver borders, and these could be measured in 2 ways. I'm going to show you both. And what we are going to do is we are going to percuss until we hear a dollar sound approximately at the 5th intercostal space. Approximately right here. And on a patient, we would make a mark right there. And then we are going to palpate downwards. And then we would measure the length in between the two to figure out where the liver borders are at. And on this patient, you would measure, and it is about 6 centimeters. Normal for a young female adult would be 7 centimeters, and anything between 6 and 12 is considered normal. Next is the scratch test, and this is another way that you can figure out the liver borders. What you do is you take your stethoscope and you listen over the xiphoid process. And while listening over the xiphoid process, with one finger you tap until you can hear the sound magnified. And same thing going downwards, and it's still about the same, and about 6 centimeters. That is it for palpating the liver. The only thing is that for the scratch test, you really want to use that if the patient is, their abdomen is distended or they are obese. The last thing we are going to check, I'm going to have you sit up. We're going to check for CVA tenderness. We are going to have you sit up in right at about the 12 rib at the costovertebral angle. We are going to hold one hand, and I'm actually going to have you kind of go to this, turn to the side so they can see.
This side?
Yeah. You're going to hold the hand, and you are going to use the other hand, and you're going to tap with the ulnar surface of your hand. Any pain with that?
Mm-mm.
And same thing, no pain with that. Okay. If there was any issues with the kidneys, they would have some pain with that. Again, my name is Ryan Dadinsky. I am in the RN-BSN program at the University of Akron, and that is my abdominal assessment. Thank you.